Dr. Mike LeNoir, and this is the Wellness Watch. Good health and welcome to today's edition of the Wellness Watch. I'm your host, Dr. Mike LeNoir. Very special program for you today. We're going to talk about urology, diseases of the urinary tract. Our special guest today is Dr. Dawud Lankford. He is the Chief Medical Officer of UroHealth in Oakland, California. Dr. Lankford, welcome to our program.
Hey, hello, Dr. LeNoir. Thank you for having me.
Tell us a little bit about what is UroHealth.
Well, UroHealth is our practice in urology. It's rooted in prevention of disease, and it's also rooted in optimizing urologic health. We want to prevent those urinary tract infections and issues with urination in females, and we also want to optimize and help urinary issues with males.
So, we got a lot of things we could talk about today, but we're going to focus on a couple of things. First, we're going to talk a little bit about erectile dysfunction, sometimes a very sensitive subject. And then in the second part of our program, we're going to talk about urinary tract infections. So let's start with the issues around erectile dysfunction. Most men have difficulty even discussing it, much less seeking care. Tell us a little bit about what you see, how it presents, or how they present, what you do to make them comfortable,
But essentially, erectile dysfunction, it is a disease process that affects many people. There's a lot of causes for erectile dysfunction. And so part of the process of sort of getting to understand what the cause of erectile dysfunction is getting a good history of your life, your lifestyle, and all the other disease processes that contribute to affecting your erections. And then, one of the things that we like to talk about at UroHealth is the prevention of erectile dysfunction and also the optimization of your erections as well. I mean, sometimes we can improve your erections if you don't feel like they're quite up to par.
Now, when you say prevention of erectile dysfunction. Now, I know there are some medical conditions that do it, but a lot of it is more psychological, isn't it?
Well, I like to say that 50 to 75% of all erection issues are psychological. Now, that's not completely true, but the psyche has a lot to do with you being comfortable with getting your erections. However, in UroHealth, we like to talk about prevention in the sense that you're going to optimize or make your health the best it can possibly be. That means control your high blood pressure, control your diabetes, and think positively about sexual experiences and the use of your sexual equipment.
Now, most men who come to see you, do they have medical conditions, or is it more of a psychological issue? And even if it's a medical condition, do they find it difficult to overcome that and talk to you about the problem?
That's a good question. I think that a lot of men have sort of a blend of both. And so the mentality that we sort of promote towards erection and erectile dysfunction is that let's look at how you feel about this experience and let's enhance that or talk about these things. And then also let's dot every I and cross every T when it comes to your organic health, or your blood pressure, your diabetes, also the actual function of your penis itself, the blood flow in and outside of the penis, when it's in the erect state and when it's not in the non-erect state. So I would say, the majority of the patients that come to see me for erection issues have a blend of some psychiatric sort of issues, some anxiety towards sexual experiences, as well as have some organic issues that relate to their overall health.
Oh, so when somebody comes to you and says, Dr. Lankford, I just can't get it up, what does that workup look like?
Yeah, the workup essentially starts off with blood pressure, history. Has this ever happened to you in the past? And then also, are there any contributing issues that could cause this problem? And, also the question would be sort of delineating exactly what happens when you have a problem with your erections. Is there a problem with starting your erections? Is there a problem with controlling and keeping the erections? Or is there a problem with just the whole inability to find a partner to have sexual intercourse with? So you don't even know if you were to have an erection.
Now, you don't help them find partners, though, do you? That's not part of that's not
part of this talk. Yeah, that's not part of today's talk.
That's not part of the therapy. Are there special techniques and tests that you use in order to make the diagnosis of what's causing this problem?
Yes. Most urologists use the International Prostate Symptom Score as well as the Sexual Health Inventory for Men to sort of typify urinary symptoms and sexual function symptoms, specifically the Sexual Health Inventory for Men. We call it the SHIM for short. And that sort of describes the quality and the situation that you may have erectile dysfunction or issues with erections, as well as your feelings and your feelings towards your erections. And then if there is an organic cause, and there's a second layer of tests that can be done that will help understand what is going on with the penis and why you're not getting erections. And that can come in the form of ultrasounds of the penis while it's in the erect state, to see if the arteries and veins are acting properly.
I'm not going to ask how you get to that state, but obviously that's an important piece of it. Every week I hear on the radio advertisements for clinics for erectile dysfunction that guarantee 99% success rate. First of all, before we talk about your particular approach to management, what can you do about the treatments that gets to the 99% level?
There's a lot of talk about relative percentages of success, and I never give percentages of success, because if it's 99% and there's a 1% failure and you're in that 1%, then that 1% is 100% to you. And so it's really a discussion of trying to get at what the root cause of your erection issue is, and the relative treatment options that exist, and going through those treatment options, and starting off at the oral, starting off at behavioral changes and conservative treatments, and then moving on to some of the oral therapies, and then moving on to some of the more invasive therapies. And from those, I look at, each individual therapy and how that relates to the specific person that I'm treating, rather than give an umbrella success rate that may not relate to you.
Right now, let's talk a little bit about those therapies. How do you approach, what are the therapy options, and how do you approach the decision about what to do for any individual man that you see?
Yeah, so after the initial interview, after we've, sort of discussed conservative options of changing the way you view the sexual relationship, changing some of the timing of intercourse and things of that nature. And then we enhance all of the things that we can prevent as far as blood pressure issues, diabetes issues. We enhance those things. Conservative measures I'm speaking about. Then we move on to actual medications and things of that nature. And a lot of people can take a pill, and these pills are very common, the phosphodiesterase inhibitors. Those pills, there's 3 or 4 pills out there. Newer forms have come out. They all function through essentially the same mechanism. A lot of people ask about the differences in each pill, and they are essentially the same. Some people like other pills some people like some pills better than others. And it's up to you to sort of try different pills to see what sort of, action that you get from the pill. But we move on from the pills to more intensive forms, injections, intraurethral suppositories. These are all topical, if you will, treatments. One is injected directly into the penis, the other is placed into the urethra. We also have the use of vacuum-assisted devices. This is the device that we use on top of the penis to suck, to cause a suction mechanism to increase the blood flow into the penis. And then usually a penile ring is used to trap that blood in the penis. And when these stepwise treatment options fail, first the conservative exercise, diet changes, then we move to medicine, oral medications. Then we move to these topical treatments, which I described collectively as topical, which would be the injectables, the intraurethral suppositories, and the vacuum-assisted devices. Then we move on to more advanced treatments, such as the inflatable penile prosthesis. Now, there are some therapies that are termed from the American Urologic Association as experimental. And these treatments in the form of shock wave therapy or plasma, sort of the Kobe Bryant removal of plasma from the blood and then injecting it into the knee. Many people are doing this into the penis itself, but these are seen as being experimental therapies and don't have any long-term data to show their efficacy. However, the short-term data is quite encouraging for the shock waves to the penis. I think you there?
Yeah, Dr. Lankford, this is just part one in a series of programs that we plan to do on erectile dysfunction. This is just, I don't want to say whet the people's appetite. I mean, I want to get it. I could probably pick a better term. But the next time we get together, maybe in a month or so, we'd like to see some of these devices and go a little bit more in detail of how you approach the management of erectile dysfunction. But this gives certainly men who are listening to our program, we're reluctant to talk to a urologist, gives them the options and lets them know that things can be done. So now we want to move on. To talk about a different subject. Okay, so I'm going to bring Donna in now. Donna, and you go ahead and do your interview. And if I'm not back from seeing these three patients they just put in front of me, just say thank you, Dr. Lankford, and I'll end the program after I get back. But I'm getting ready to bring you in and introduce you on our program. And so thank you, Dr. Lankford, for just an introduction to the evaluation and management of erectile dysfunction. Like I say, next month we'll be delving into this a little bit more, and perhaps he'll show us some of the devices and some of the techniques that he uses. Now I'm going to introduce Dr. Donna Carey. She's going to talk to Dr. Lankford about the situation with urinary tract infections, especially in women. Dr. Carey, welcome to our program, and let's get Dr. Lankford back on the screen.
Hi, Dr. Lankford. Well, I'm going to chat with you and ask some questions about urinary tract infections in women. And I always like to start with the basics because I want everyone to level set what they understand, and then we can build on that foundation. So let's start with the basics. What is a urinary tract infection?
A urinary tract infection is a noted infection or colonization of at least 100,000 colony-forming units in a urine sample. And so typically when you diagnose a urinary tract infection, there is a symptom that prompts you to get your urine analyzed. The urine analysis, or the analyzing of your urine, will demonstrate white blood cells in your urine, bacteria, or something that's called nitrite positivity. And this will prompt that urine to be then sent for a culture, which is basically growing up the urine in a certain medium, which is food, and certain bacteria grow out of this urine. And the lab will give us the actual number of colonies of the bacteria that grow in the urine. And we look at urine that has a colony count of greater than 100,000 colony forming units as a urinary tract infection. Now, sometimes we can still have a urinary tract infection, even with a lower count than 100,000, if there's significant symptoms associated with the growth of bacteria. But that's a little bit less common as the actual 100,000 colony forming units.
Awesome. Thank you for that. And then you mentioned symptoms. So what are some of the symptoms of a urinary tract infection?
Symptoms are really important to sort of understand, because a lot of my discussion with women about urinary tract infections have to do with describing the difference between a symptom and an infection. So the symptom, which can be associated with a urinary tract infection, but may not necessarily be an infection, can be urgency, the sensation to void, but not voiding much. It can be frequency, having to void or urinate multiple times in an hour. And then also burning when you urinate, in which we call dysuria, or burning when you urinate. Also, straining to urinate. These can all be signs or symptoms of a urinary tract infection, but they don't actually mean you have a urinary tract infection.
Right. Yes. So that's good to know, right? Because a lot of us like to self-diagnose. And so it's really important to understand that those symptoms don't always equate with an infection. So it's good to take your symptoms to your doctor and have a conversation and get your urine checked to see if you actually have an infection. Great. So what are some of the risk factors? How do you even get a urinary tract infection? What puts you at risk?
Yes. So urinary tract infections can happen just generally in life. There's a lot of people who become dehydrated. It can be the perfect storm that can cause urinary tract infection. However, if a female or a woman has more than one urinary tract infection in a year, more than two urinary tract infections in a year, then that's looked as a little abnormal. There may be some sort of inciting cause or a root cause to these urinary tract infections. And some of these root causes or these issues that can make you more susceptible to urinary tract infections, aside from being a female or being a woman, is, essentially being dehydrated. We have a description of urine, a river versus a pond. A pond things fester in a pond. If you have some sort of obstruction to your urine, or you're not urinating at a regular time interval throughout the day, and you're holding your urine for extended periods of time, then this can be the cause of a urinary tract infection. It doesn't mean it's always the cause of urinary tract infection, but it could be one of the causes. Also, one of the causes of a urinary tract infection can be sexual activity. During sexual activity, there can be translocation of bacteria from the rectovaginal area to the urethra, and this can cause a urinary tract infection. It doesn't always cause a urinary tract infection, but if you're susceptible, it can cause a urinary tract infection. And then some of the other constipation, these are some of the other regular causes of urinary tract infections is constipation. And a lot of times when the rectal vault is full of stool, right, and you're not having regular bowel movements, this can cause the translocation of bacteria or the increase in susceptibility of the translocation of bacteria to the urethra.
Yeah, I'm going to steal that from you, Dr. Lankford, the pond versus the river. Okay. I think that's awesome to think of. To think if you're not urinating regularly or stooling regularly, that can put you at risk for a urinary tract infection. How do you treat them?
Yeah. So a lot of times the treatment options sort of have come, when they see a urologist, they're kind of down the line when it comes to treatment. They've already tried multiple antibiotics and they failed, or they have recurrent urinary tract infections. But the first line for treatment would be, I always say, changing your behavior, conservative management. That is drinking lots of fluids, making the pond a river, or the lake a river, And then second, avoiding constipation. I always tell all my patients, make sure you're having bowel movements regularly every day. And then make sure those bowel movements are soft, because all of these are risk factors. Also, if you're highly sexually active or you think it may be related to your sexual activity, you should void before and after sexual intercourse. These can further make the pond or river and offer movement to the urine flow to prevent infections. Washing your hands, yourself and your partner prior to sexual intercourse, perhaps washing your hands and things of that nature could prevent these urinary tract infections related to those causes. Now, if the conservative management does not help, does not prevent these urinary tract infections, obviously antibiotics to treat the bacteria is important. And once you've treated with those antibiotics, I always recommend treating with probiotics, reconstituting the urinary tract with the good bacteria that help outcompete the bad bacteria. In all of our bodies, over our faces, over our skin, all of our skin, there's bacteria. And there's bacteria that aren't pathogenic, that don't cause infections, don't cause irritations. And those are the good bacteria. And so I tell people that we should prevent these urinary tract infections or treat these urinary tract infections by reconstituting the good bacteria, especially after we've taken antibiotics.
That's good. So in thinking about prevention, I know as a pediatrician, I often, will teach my young girls how to wipe, right? Wiping, not back to front, but front to back to help prevent. And also the type of underwear people wear. So using something that's more cotton and lining instead of other materials. Am I on the right track? Is that what we should be telling?
100%. I think, the spandex can sometimes trap in moisture. And if you're not changing your underwear regularly, or if you're not finding a way for that moisture to be dissipated to leave, then you can increase your risk for urinary tract infections. So definitely wiping front to back. That was one thing I forgot, but that's important, especially in the pediatric population and younger girls, teaching them that, trying to prevent the cross-contamination between the rectum and the vagina.
Yeah. What about, we as women like to always have perfume everywhere. What about any risk factors with using products that are perfumed to wash with or to bathe with in bathtubs? Does that cause an increased risk for urinary tract infections?
I have not found in my practice or in the patient population that I serve, there's an increased risk with the perfumes, but I do find a lot of irritation with some of the products with perfumes and things and different, products that have different sort of formulas. And so a lot of times with contact dermatitis, I found very often, the detergent that people use in the genital urinary area sometimes can get in close contact with that skin and cause irritation. And so I think that could in turn give you urinary symptoms that you may think is a UTI, but it's more urinary symptoms. So I think definitely reevaluating what you use in terms of detergents and perfumes is important to simply see if it just irritates your body in general.
Yes, that's great. Now, we're as Black people, we have a lot of homeopathic remedies for a lot of issues, for a lot of diseases. So, we've heard about drinking cranberry juice or eating yogurt, and some people actually even put yogurt in their vaginal area. What do you think about those type of remedies? Is there any basis to that in helping to treat urinary tract infections?
Yes, I think that the issue is as we get older, there's a general aging process that happens in the genital urinary area. And we term that in females atrophic vaginitis, postmenopausal atrophic vaginitis. And that's where the female genitalia in that area becomes drier. It becomes less hydrated. So some of the treatments to prevent urinary tract infections or to treat sort of the symptoms of urinary tract infections is hydration of that area. And so oftentimes we'll talk about hydrocortisone cream to the area. And then also in a lot of cases, especially in the elderly population that have recurrent urinary tract infections, we also talk about Premarin cream and estrogen cream that is applied to the vaginal area to loosen up the skin, to promote health and wellness of the vagina. And so I think that definitely has some some benefit, topical therapies to the vagina and the vaginal mucosa to facilitate a more healthier skin texture.
Mm-hmm. What about drinking cranberry juice? Is that good? If it's really healthy, not a whole lot of sugar, folks. Don't drink the cranberry juice with a whole lot of sugar in it. But if you have, pretty much straight juice in your cranberry juice, is that helpful?
Well, cranberry juice is one of the things it's a remedy. It's been used for years. There is some data that shows that it may be helpful, but there's a lot of different homeopathic remedies, i.e., just drinking water that can be helpful. And I think that kind of goes along with sort of movement in the urinary system. I don't think that taking cranberry pills and things of that nature, I don't prescribe those things, not to say that they don't work, but I think that they're more sort of lesser of a benefit than actually changing the hydration level. And then also there's other medications that have a clear mechanism of action, like D-mannose. D-mannose has a clear mechanism of action, which involves the sugars that bacteria eat, right? And so a lot of these things, it helps for the probiotics and the environment of bacteria in the genital urinary area, promoting a good and healthy environment. So I think those things I would do first.
Well, thank you, Dr. Lankford, for joining us on today's edition of Wellness Watch. We're going to delve a little bit more deeply into erectile dysfunction next month. And also thank you, Dr. Carey, for the interview on urinary tract infections. I had really no idea how much of a problem that is. But most of all, I'd like to thank those of you who joined us on today's edition of Wellness Watch. Remember, health is your biggest asset. I'm Dr. Mike LeNoir. We'll talk again next week.